Dr. Henry, I would like to ask about schools. We've heard a few different situations at high schools across the province where students have been gathering at local convenience stores or local restaurants and are mixing cohorts in some regards, and also potentially, touching things and potentially being exposed to the virus there. Are you concerned about this sort of activity that's happening sort of at lunchtime and during break times of the school day?
Yeah, we're all adjusting to what the new school looks like, and I know it's very different particularly for teenagers, and that strong urge to be socially connected at that time in our lives is a very challenging one to overcome. But yes, now's the time where we need to stay small, and it will not be forever. And sometimes when you're a teenager in particular, it does seem like it's the end of the world. But I also know that young people are very resilient and very adaptable. And so now's our time to support each other in keeping those groups small, knowing that that is important so that we're not spreading it to each other, but also not bringing it home to our families, our loved ones, our grannies, our aunties and uncles. Those are important things, and I know young people believe that as well. So now's the time, we're getting over the novelty of how this is going to work, to put in place those rituals, those procedures, so that we can safely go back to school, continue the learning and the connection that we have, and not have those potential exposure events outside of the school setting. And there has been some transmission in groups of children, young people who have been hanging out together outside of the school setting, and it affects the whole school community. So parents and young people, let's support each other to stay small.
Richard, do you have a follow-up?
Also on schools, Dr. Henry, there's one case of a school, I think, in North Vancouver that's had a few classrooms that have been shut down due to concerns about COVID. Is there a number in your mind in terms of classrooms in a school that would shut down to create the entire school being closed? Or in what situations do you provide advice that an entire class should be asked to isolate, or are there guidelines for that?
There are indeed guidelines for that, and we're following them in public health across the province. So what we have are exposure events, and we've had quite a few of those, not that many compared to the number of schools that we have, and there has been no transmission events or outbreaks in schools yet that we've seen, so that's good. But we also look for where people have been infected, where they've been exposed, and what type of exposures they may or may not have had in the school setting. So it is very likely that children who are in the same classroom may have had the same exposures. There's also exposures in the community that people bring with them. And so health authorities in all across the province will follow up individually with anybody who's had a close contact with somebody who has tested positive for COVID-19. And in some cases, small numbers of children have been asked to stay home from school. But it would really depend on the situation. And I would encourage parents to recognize that exposure events do not mean that your child has been exposed to COVID-19. Unless you've had a call directly from public health, you don't need to worry about that, and we are being very transparent in putting up where those exposures might have happened so that everybody knows that public health is on it, and that we're working with you, and that we're working with the school, and that we know who needs to be isolated and who doesn't. So that's really important. Just because there's been an exposure event does not mean you need to keep your children home. If we have an outbreak, it may mean that the whole cohort may go home. The only time that I could see that a school would close is if too many of the teachers or staff had been exposed to each other or become sick, and the school couldn't operate safely. So there's many different scenarios that we could look at, but for the most part, what we see are very limited exposure events and very small numbers of people who might have had close contact either in the school or outside of the school environment.
Next question is from Tina Lovegreen, CBC.
Thank you so much. Hi, Dr. Henry. I'd also like to ask a question after we heard from several North Shore parents about concerns over how close contacts are identified and who is tested. So how is someone determined to be a close contact when there is an exposure in schools? And why not tell the entire class or cohort, given that kids often play with other kids and so why not ask health authorities to contact everyone in the classroom automatically, including the teacher if there's a positive case?
Yeah, we often have a really good idea of where people have been exposed and what type of things that they've been involved in that are risky or more or less risky. We've been doing this now, as you know, for some time. So the health authorities are very good at determining that, and we have criteria for when somebody has had close contact. So it has to be for a period of time within a certain setting, whether outdoors or indoors, and the types of risks that we see with those types of contacts. And absolutely, the health authorities follow up with the schools, they follow up with the teachers, and they get the information they need to make the risk assessment for that individual case. And we can have confidence that we're doing that consistently across the province with every single case.
Tina, do you have a follow-up?
Yes, please. We've also heard that there were cases where the siblings were told not to isolate and go to school. Some even told they don't need to get tested, but the parents decided to go against the public health advice they were given by 811, fake symptoms, and actually get their children tested, who actually ended up testing positive. So given that we've heard, of these asymptomatic cases, that have ended up testing positive, any plan to change it that everyone in the household has to get a test when there's a positive case in the family, and whether they should all have to isolate?
Yeah, so we test people for the most part who have symptoms, even children, and we know that that's how most people are identified. When somebody is a close contact, there are situations, and certainly in household situations, where we do recommend that people all get tested. But those will be determined depending on the type of exposures, the type of transmission that we're seeing. And we do that in some communal settings. We do it in long-term care, for example, as well. And I think we need to be a little bit careful about, there's lots of rumors and information that's going around, and sometimes it gets misinterpreted, or it may not be exactly what we think it is. And we have to find that balance between protecting people's privacy and making sure that people are aware of what's happening in our communities. And I think we're working through this as best we can to support people in doing that. There are certainly situations where people should be tested, whether they have symptoms or not. But for the most part, if you're a contact and a sibling of a contact, then no, you don't need to stay home. You don't need to be tested. But what I encourage people to do is take the advice of public health and take the advice that you're given from 811.
Marcella Bernardo, News 1130.
Hi, Dr. Henry. Still with school situation, there seems to be a lack of confidence, as we've been hearing this afternoon, in safety protocols in schools, considering how many kids are already going home with a cold. So if we can't protect these kids from spreading the sniffles to each other, how can we possibly expect them not to spread COVID-19?
Yeah, well, the sniffles happen a lot, and there are some viruses that are more infectious than others. And we know the common cold viruses do spread very easily from a variety of different ways of transmission. It's not the same necessarily as the spread of COVID-19. But it is a reminder to us all of how important it is to do those basics of washing our hands regularly, covering our mouth when we cough, making sure we're cleaning our space, making sure we're keeping our distance, and if we're not feeling well, to stay home.
Marcella, do you have a follow-up?
I do. You've mentioned that you don't want people to be talking about rumors and things like that, but we're hearing from parents that are being sent essentially hush letters where they're being told by health authorities and by the schools not to share that information with others. And that kind of goes against the commitment of transparency. If parents are being told that there might be an exposure in their child's school, why wouldn't you want them sharing that information?
And that information is being shared and it's being posted publicly, so everybody is aware of what schools we've had exposure events. We'll also be publishing or posting if there's an outbreak in a school. We'll be putting that information up. And I don't believe that there's been hush letters, as it were. We do ask people to respect other people's privacy around specific individuals and not sharing information perhaps about their own individual situation. And we do reassure people that we're not going to be telling the rest of the school or the class about your child or your family interaction. So I would just encourage people to look at the websites, to be in touch with your principal, your school, to make sure that you have the information that you need and that public health will be there working with every school on this.
Hi, Dr. Henry. I have questions still about the school situation. I'm still a bit confused, and I think maybe my confusion is shared by some parents that I've talked to. About the cases that are being posted publicly by Vancouver Coastal Health. Is it the case that they will be posting anytime a person from the school community has tested positive, or anytime that person has been confirmed as being in the school while they could have been infectious, or is it only when you can't identify close contacts?
Yeah, it is across the province. All health authorities will be posting exposure events. So that's somebody who's tested positive, who is in the school environment during their infectious period. So when they could have potentially exposed others. We know, and we've seen this in June and again in the last couple of weeks, that we have had teachers and other staff who have been exposed in their family or a social environment and have not been at school, and children as well who've not been at school at any point during their infectious period. They were detected at home and had been away from school. So those are not exposure events, but across the board, in Vancouver Coastal as well, any exposure event, anybody who's tested positive who was in the school during the period when they were infectious will be posted.
Jane, do you have a follow-up?
I do have one follow-up, also related to schools, which is the question that I've been getting from parents. Why is it okay for siblings of children who are self-isolating at home to go to school, given that those kids have probably had a lot of close contact before the self-isolating began?
So it depends a little bit about why they're isolating. So if they are self-isolating because they're a close contact of a case, then their siblings are a contact of a contact, we call it. So they're not at risk. If their sibling develops symptoms or illness or becomes test positive, then they are at risk. So while one child is self-isolating because they've been a contact, we want to minimize the contact that the other children have with that child. So that's part of making sure that we're keeping and protecting the rest of the household if somebody has been exposed. So we know that when you've been exposed, not everybody will get infected with the virus, and it depends on the risk setting that you're in as well. And we know that it can happen over a period of 14 days, the incubation period. So when we ask somebody to self-isolate, we have unfortunately right now, we still don't have any medications or a vaccine that can prevent somebody from getting sick if they've been exposed to enough virus. But on average, in most settings, people only transmit to one or two other people, even in close families. Less than 14% of the families that have been measured when we've had clusters in families, it's not everybody that gets transmitted. So if somebody has been exposed to a case and they're in the incubation period and they're self-isolating, we want to make sure they're staying away as much as possible from other people in the household.
Next question is from Claudia Van Emmerich, Global Okanagan.
Hi, Dr. Henry. Thanks for taking my question. I wanted to follow up on Richard Zusman's question about students gathering, particularly on lunch breaks and popular hangout spots, in front of convenience stores, that kind of thing. We've received some troubling video into our newsroom, as well have witnessed it firsthand ourselves, of a large number of students gathering at these popular hangouts during lunch breaks. We've witnessed, zero social distancing, the majority of these students not wearing masks. And we're talking about, a large number of students. The government has spent more than $45 million implementing safety measures to keep everyone safe. Do you feel like those efforts are being spoiled during these breaks? And can anything be done to prevent it?
I think this is where my message to all of us is now's our time to make a difference, in protecting our communities. And that means young people as well. They may not be watching me, but I encourage all the influencers out there to talk to your friends, to make sure that you those are not the things that we want happening right now. So parents, talk to your children as well. This is important for protection of all of us. We do know that young people are less likely to have severe illness, and it can be very challenging. And I empathize with teenagers in particular. Who wanted this at this point in your life, where there's so many important things that you're trying to do around social connections. And I know it's challenging, but it's not forever. It is for now, and we need to be adaptable, and we need to support young people in doing the right thing. And we can help the places that people are going to. We need to have conversations with young people in our lives, and help them find other ways of having those social connections without gathering together.
Do you have a follow-up, Claudia?
Just a very quick follow-up. Because this is happening off school property, the school district obviously can't do a whole lot. I guess what role parents play? Are parents responsible for really, instilling that message in their children to physical distance and wear masks?
Well, I do absolutely think we all have a role as people in our community, so parents, grandparents, but also in the school community. We can give those messages to kids, to young people. We can help them understand the importance of it. And, we don't want to jeopardize the school year. We know that the school environment is so important in many different ways for young people and for children. So, this is something we all need to do together. It's on all of us to take those actions, to support each other, to find ways to allow those necessary social interactions without putting our communities and our families at risk.